Welcome to the lecture entitled The Thoracic Cavity as a Conduit, the third lecture on the thoracic wall. My name is Carlos Andres Suarez-Quian. I am the creator and narrator of this lecture. Let's begin. Previously, I discussed how the thoracic cage offers protection to the internal organs and helps us in respiration. In this lecture, I will present the third function of the thoracic cage and learn how it serves as a major conduit of clinically relevant structures. The two objectives of this lecture are to first describe the structures that pass through the thoracic entryway, and second, describe the structures that pass through the thoracic exit. I will use the terminology of entryway and exit instead of inlet and outlet to avoid any confusion with clinical terms. Let me remind you of the location of the thoracic entryway and what makes up the anatomy of this entryway. On the left, I show you a thoracic cage as you see it from an anterior view, and on the right, the thoracic cage is presented as it is seen from above. The arrow now points to the thoracic entryway. Let me now define the bones that make up the entryway. The manubrium makes up the anterior border of the thoracic entryway. The lateral borders are the cartilages and the rib component of the first rib. The body of the seventh vertebrae makes up the posterior border. Let me now show you the thoracic exit. Again, on the left is the anterior view of the thoracic cage, and on the right, the inferior view. The arrow indicates the much wider diameter of the exit than that of the entryway. The margins consist of the xiphoid process anteriorly, the costal margin inferolaterally, and the 12th rib and the 12th vertebral body posteriorly. However, understand that the exit is covered, for the most part, by the muscular diaphragm. Only a few openings exist in this diaphragm for structures to exit the thoracic cavity. So what enters the thoracic entryway? One way to understand what is really happening at the entryway is to list the 11 physiological systems defined in our bodies and then examine what components of these systems pass through the entryway. Of the 11 physiological systems recognized, only components from the respiratory, cardiovascular, digestive, nervous, and lymphatic systems traverse the thoracic entryway. Let's identify some of these major components now. Let me start with the respiratory system. The organs of the thorax have been superimposed on a thoracic cage. Of the respiratory system, the trachea travels from the neck through the thoracic entryway into the thoracic cavity. Most students could have guessed this fact from just a basic anatomy we all learn from going to school. However, what is less known, yet clinically relevant, is that the cupula, or apex, of the lungs extend into the neck. That is, they pass through the thoracic cavity entryway. And why is this important to know? Because any injury to the base of the neck can be lethal due to injury of the lungs found there. We will study these types of injuries and why it impedes our breathing in a later lecture. Components that form the cardiovascular system that pass through the thoracic entryway include the right and left brachiocephalic veins, as well as the main vessels exiting from the aorta, the brachiocephalic artery, the left common carotid, and the left subclavian artery. Realize that the contents of the veins and arteries are traveling in opposite directions at this level and in these structures. The veins bring blood to the heart, the arteries take blood away from the heart. Their definition as being arteries or veins has nothing to do with the level of oxygen being carried by these vessels. You will see additional images of these vessels in subsequent lectures. Next, the esophagus is the one component of the digestive system that traverses the thoracic entryway. Important peripheral nerves enter and exit the thoracic entryway. Among the nerves that enter are the right and the left vagus nerves and the right and left phrenic nerves. Note, only the right phrenic nerve is present in the image. The one nerve of clinical relevance that exits via the entryway is the left recurrent laryngeal. Think of this nerve and lung cancer. The relationship will become apparent later. But why not the right recurrent laryngeal nerve? Because the right recurrent laryngeal nerve does not enter the thoracic cavity. Hence, it does not exit it as well. These important relationships are more fully discussed in embryology. Finally, there is the sympathetic trunk. As you may recall from a previous lecture, all preganglionic sympathetic nerves originate from thoracic nerves, and some must exit the entryway to travel to the neck and beyond to provide sympathetic innervation to the head. The last system we must consider is the lymphatic system. If I now zoom in on the thoracic entryway, there is an important structure that exits the thoracic entryway from the thorax into the neck, and that is the thoracic duct. When you first see this vessel in a dissection, it is difficult to imagine that it carries approximately 75% of all lymph fluid from the body back into the circulation. But it does. Imagine the complications that can result if this duct is injured either from trauma or surgical mishaps in this region. We can now repeat the same exercise at the level of the thoracic exit, although realize that these structures will be traversing the muscular diaphragm. And I think it is clear that there are 3 openings in the diaphragm. With respect to the cardiovascular system, there is an opening for the inferior vena cava in the diaphragm. There is also an opening for the aorta. Technically, however, the aorta does not travel through the diaphragm, but rather behind it. Think what would happen if it did. Every time you breathe, the blood supply to the lower body would be cut off by the contracting diaphragm. So, the aorta does not traverse the diaphragm, it travels behind it. The third opening is for the esophagus, a component of the digestive system. These openings are found at vertebral levels T8, T10, and T12. By knowing these levels, you can get an idea of where you are when looking at a film. With respect to the nervous system, many of the nerves I described previously travel as far as the thoracic exit and are found here. They include the right and left vagal trunks that exit the thorax along with the esophagus, the right phrenic nerve that travels along with the inferior vena cava, and the left phrenic nerve that pierces the central tendon of the diaphragm and innervates it on its underside. The exit of the right and left phrenic nerves through the diaphragm will help you understand referred pain to the shoulder from abdominal pathology. Stay tuned, this will become apparent in a different lecture. Finally, we see the greater splanchnic nerves exiting behind the diaphragm. This nerve is part of the sympathetic system of nerves. The last system to consider is the lymphatic system. The structure that is relevant here is the cisterna chyli, the receptacle that receives major lymph vessels from the intestines and ultimately drains to the thoracic duct. Hence, the lymph collecting system starts below the diaphragm, travels through the thoracic cavity collecting thoracic lymph, then exits at the chest to drain and return to the circulation at the neck. The body's a marvelous, albeit complicated machine. This now concludes the three-part lecture on the thoracic cage. I wish to acknowledge the cadaveric donors who made imaging of the anatomy possible, and specifically I wish to thank Mr. Mark Savonia, whose skill in preparing these specimens made this lecture possible.